We decided to work with Electa many years ago because of their interest and dedication to brachytherapy and their great support in seeing us succeed. They've been dedicated to education over the years and have helped us and asked us to help them, and we've been more than happy to do that. Brachytherapy is an excellent option for many skin cancer patients because it allows us to hypofractionate or treat with fewer fractions. Traditionally, we've had to treat with 4, 5, sometimes even 6 or 7 weeks of daily treatments. But with brachytherapy, one of the greatest advantages is we can bring that down to only 6 to 10 treatments.
We have been doing this for at least, I will say, 8 to 10 years. My recollection is we started somewhere around 2005 or something like that with Leipzig. And so we've been doing this for quite a while, and we actually implemented shortly after that the skin workshop, and it has been very successful. The overall format of the skin workshop is basically having some didactic lectures, but also some hands-on session. And in addition to that, we actually provide them an opportunity to actually see some clinical cases. They will be seeing patient, whether it's a consult or whether it's a follow-up or an actual treatment. So they will actually see the whole thing. So it's really A to Z.
We've treated a wide variety of skin cancers over the years, and fortunately we've been able to see most of those and present most of those during the skin workshop live. We've had mostly basal cells and squamous cells, and we really make an effort to differentiate the various subtypes in basal cells and even squamous cells because I think that's important to recognize that they don't always behave the same. Superficial basal cell, for instance, is often multicentric and may need a little bit wider margin, as does sclerosing basal cell, and I think that's important to recognize. Various types of squamous cell as well that behave somewhat differently. We've also been fortunate to see Merkel cells, melanomas, atypical fibroxanthoma of skin. Attending the skin workshop can be very helpful in initially getting your skin program going if you're interested in developing a skin cancer treatment program, especially a skin brachytherapy program, but also if you'd like to jumpstart it and really rev it up or bring it to the next level. We're very fortunate. We have a great relationship with our dermatologists and have been able to truly develop a world-class program here with the cooperation of our pathologists and dermatopathologists and Mohs surgeons. So you get to see all the benefits of that and the benefit of our experience and how to develop that in your own program.
My role for the workshop as a medical physicist is basically provide the attendees with some knowledge regarding the dosimetry of all applicators and devices that are used for the skin brachytherapy, and also provide them with some knowledge on the patient positioning, the QA component, and treatment planning, and all that. So it's really the overall, pretty much the dosimetry component. Most of the attendees, when they attend this workshop, one of the things that they actually appreciate or enjoy more is the hands-on component, because you can provide training by, say, looking at a video or reading a paper or whatnot, but I think when you see the actual case live, and you will get a lot more out of that. So I would say the majority of that is pretty much the hands-on session that's very critical. By attending this workshop, the physicists will get probably the bulk of the skin brachytherapy component, which is pretty much, they actually handle the commissioning component first before starting the program. Second, they actually do the treatment planning, the immobilization, and everything else. So they really do quite a bit, and so they will actually get a lot of that, and they will be able to implement their program. By attending this workshop, the radiation oncologist will get pretty much the same thing as far as the hands-on component, but also they will get a lot of the clinical knowledge that's really necessary to implement the program. For someone who's interested in starting the skin brachytherapy program, I highly recommend that they should attend, whether it's this skin brachytherapy workshop or any other skin brachy workshop that's available out there, because really reading articles is not going to basically provide them with all the information. Attending the workshop provides them an opportunity to see how they can actually implement the program, how to set up the patient, how to select the patient, how to immobilize the patient, what to do in the treatment planning component. But it gives them an opportunity also to interact with a group of people that are knowledgeable to actually provide them with some feedback and raise some, answer some of the critical questions that probably are not quite clear. So it does provide them a good foundation actually to start the program. And we hear a lot about the requirement for training for any procedure that you might want to start, and I really believe that all accepted organizations such as ABS, APM, ASTRO, and all that highly recommend that people should attend an approved training, not just any training, an approved training provided by the manufacturer at an institution that has been doing the procedure for quite a while.